Administer intradermal injections. Carry medication to room, introduce self and identified client by matching name band with the MAR, and explain procedure.
So again, I'm going to the patient's room with my medication, an alcohol wipe, my gloves, and the medication administration record. I am first going to verify that I have Lydia Ocampo, and I would introduce myself to her. I would say, Lydia, my name's Natalia, I'm going to be your nurse. The doctor has ordered a TB test for you before you go to the nursing home. Can you verify your name and your date of birth, please? Okay, that looks great. Notice I'm keeping my medication where I can see it. I'm not keeping it over here where my back is to it. I'm going to keep it where I can see it at all times.
Apply disposable gloves.
I'm going to go ahead and put my gloves on.
Located the area on the inner aspect of the forearm. Avoid any visible blood vessels.
For testing, you're going to use the IV arm to test out. So again, I'm going to locate the inner aspect of the arm.
Cleanse area with alcohol using firm circular motion. Allow the area to dry.
So cleansing it with alcohol. And I'm going to allow the area to dry. I'm not going to fan it dry. I'm obviously not going to blow on it. I'm going to wait for it to dry on its own.
Picked up syringe, holding it between thumb and fingers.
So I'm going to hold it between my thumb and fingers just like so.
When stabilizing the arm and the other hand, stretch the skin on the forearm.
It works best if you take your non-dominant hand and grab underneath of the patient's arm and pull tight so that their skin's taut.
Place the needle bevel up almost flat against the skin so that the tip of the needle can be seen through the skin.
So I'm looking for the bevel of the needle. I have the bevel up, and I'm going to go in perpendicular with the skin, a very low level.
Insert the needle only about 1/8 inch.
So I insert it just about that much.
Slowly and gently injected the saline while watching for a small bleb to appear.
Now in this IV arm, you won't actually see the bleb appear, but you'll go ahead and just simulate that you would push it in. Okay.
Placed alcohol swab over the needle insertion site. Withdrew the needle quickly at the same angle as it was entered.
So to have a new alcohol wipe, just go ahead and place it over this. Withdrew it at the same angle. If I had a safety device, I could activate it or immediately place this in the sharps container.
Did not massage the area after removing the needle. Observed for signs of an allergic reaction.
Okay.
Left client safe and comfortable.
So I would make sure that they were left safe and comfortable. One thing I would like to note is in the hospital setting, you'll want to trace around this so that we actually know where we're to be looking, because it's likely that the nurse that administered the TB test won't be the nurse to read it. We want to know where exactly to look.
Discarded equipment in sharps container.
So my needle would go in my sharps container, the rest of my garbage. I would take off my gloves and wash my hands.
Recorded the medication properly on the MAR.
So again, I will note the time at which I administered the TB test, what site I used, and my initials.